Good morning, beautiful people. This isn't gonna be a happy video. I'm pretty angry about some of the things I witnessed and heard this morning. I got a first-hand view at the lack of care when a patient goes into the emergency room to be stabilized for an eating disorder. When you need stabilization, it's because your body is starting to fail. Organs start to shut down. Your body just doesn't really work anymore. You can start fainting. Cardiac arrest is on the table. A lot of things come into play. And you have to be extremely careful when stabilizing this patient, because there's something called refeeding syndrome, which can actually shut your body down and cause a lot more issues than what you're already dealing with due to starvation or the other aspects of eating disorders, such as overeating or the health effects of that. I need to do more research on that and how it actually affects people, because my battle is starvation and anorexia and restricting. And so I am currently trying to learn more about the other aspects of eating disorders and the other types, and so that I can better educate you guys and myself and advocate for those who are not receiving help as well. You don't need to be 80 pounds to have an eating disorder. You don't need to look skin and bone skeleton to have an eating disorder. Not everyone has an eating disorder, but a lot of people do. 1 in 4 people have an eating disorder. I said that in my last video, and I probably will say it in every video. 1 in 4. That's not a lot of people that don't. You know what I mean? Like, there's so many people that do, and we need to start taking this seriously. So, my issue right now is the lack of education that doctors working in the hospitals have. Now, I understand they're hospital doctors, so they're not like geared towards eating disorders. I'm not asking for all these doctors to be geared towards eating disorders. I'm asking that these doctors have some form of education on eating disorders so that people don't go without proper care. I have someone who has been in the hospital for over 24 hours now. They are very concerned about refeeding syndrome, and so they have not given her any food. It has been over 24 hours. They have given her 2 little things of hospital cup juice, and that is it. They are refusing to give her iron supplements. They are refusing to give her multivitamins. They are saying that they fear if she has any food at all, because there's no dietitian on the weekends, that she will go into refeeding syndrome and it will cause more issues. What? 24 hours? 24 hours! How do you feel after 24 hours with no food? Imagine someone who's been starving themselves for, I don't know, maybe, I'm just throwing it out there, I don't know exactly the amount. Let's say a week. So you eat maybe 2 meals in a week, and then you realize it's starting to affect your body. You faint, you go to the hospital, you explain what's going on, you let them know you have an eating disorder, that it's due to restricting, and you're really struggling. Your last meal was soup. The doctor comes in and says, well, you managed soup last week, right? That's pretty good. I have almost no words after watching that go down between patient and doctor today. I'm appalled. What human feels okay and can make sound, correct decisions about their future, their life, their health, their mental health when they haven't eaten in 24 hours. I know I don't make sound decisions when I'm not eating correctly. So, come on, guys. Get our doctors educated because they are killing patients every single day.